Good afternoon. I'm Carlos Fernandez, policy analyst at the Vegas Chamber. I'd like to thank you all for tuning into the Reopening Your Business webinar. The Southern Nevada Health District, members of the Las Vegas City Council, and the Vegas Chamber President and CEO, Mayor Beth Sewald. Before we get started, I'm going to take a moment to explain some features of this call. In order to preserve high sound quality, we'll be muting everyone in the call besides our presenters to make it easier for everyone to hear. If you'd like to ask a question or view, you can do so. If you're joining this call on the web or through the mobile app, you can ask a question by using the chat feature on the interface. We'll ask your question on your behalf. You can also ask a question by clicking the hand raise button on the interface. We'll call your name and unmute your line so you can ask your question. Once you have asked your question, we'll re-mute your line so everyone on the call can hear the answer. In order to preserve time, we ask that you please keep questions brief. We'll be taking all questions at the end of the call. Now please welcome the Vegas Chamber's President and CEO, Mayor Beth Sewald.
Thank you so much, Carlos, and thank you everybody for being with us today on the webinar. We are so happy to be welcoming our guests today, featuring City of Las Vegas City Councilman Brian Knudsen, City of Las Vegas Councilwoman Olivia Diaz. Also with us today, we have several guests from the Southern Nevada Health District talking today about the reopen process as it relates to health issues and best practices for businesses that we all need to know as we think about reopening. I will introduce our guests from the Southern Nevada Health District in just a moment. But I want to let you know about another series of webinars that we're launching tomorrow. You know, we're talking an awful lot about navigating the reopen of our businesses from today's health perspective to a new series, again, that we're launching tomorrow regarding technology in the workplace. We're going to be featuring world-renowned architects, architectural firms, and then a global strategy leaders tomorrow on a series that starts in partnership with Matter Real Estate. So we're really excited about that. We think you're going to be very interested in that series of webinars. You can go to vegaschamber.com to register, and that one is tomorrow at 11 o'clock. Also want to make sure and introduce you, or invite you, I should say, to our Exit Issues series on May 8th. That one is featuring Congressman Stephen Horsford. So those are just a few of the upcoming events that you're definitely not going to want to miss. All right, let's get going today. It is my pleasure to introduce to you City Councilman Brian Knudsen. We're expecting City Councilwoman Olivia Diaz. I don't think she's on the line just yet, but we will let you know when she joins us. We also have from the Southern Nevada Health District, Chris Saxton, Environmental Health Director, Herb Sequera, he's the Environmental Health Manager, Solid Waste and Compliance, Karla Shoup, Manager of Consumer Health, Larry Rogers is with Food Operations, Mark Bergtholdt is Special Programs, and Rob Cole is a Health Specialist Legionella Program. So lot of titles going on there, but thank you all so much for joining us today. We really appreciate you being here on the call with us. And who wants to lead us off? Is it Chris? Would you like to lead us off on some of the latest? Give us an update on what's happening at the Health District, please.
Sure. So I can give kind of a high-level overview of what we're doing. As you know, we're waiting for the governor and his orders when it comes to reopening, but we did want to help industry out. We, of course, have our regulated facilities. We've tried to provide guidance, what we can do, checklists for any of the new businesses, how they can deal with COVID. We came up with an employee questionnaire, which makes it really easy for that business to check their own employees. And then we link to the CDC what they need to do. We're trying to get all these links together so that it's as easy as possible. We also did look at just about a general business that we don't regulate. How can we help them out in these COVID times? And we put together just a general business reopening guideline that goes over things you need to think about that you've never had to consider in your business, like COVID. What kind of disinfectants do you need? Well, we tell you, we link right to the EPA's website that gives you basically those kind of disinfectants, the contact time, the amount of time that liquid or spray needs to be on a surface to be effective. And we just go through all that for everybody just to try to understand. Of course, we got, for our restaurants, there's going to be more requirements because we regulate them. We try to give them best practices to use. Of course, if the governor does issue any separate orders, we'll always update our guidance to go with it. And I think that's a good overview. And certainly I'll leave it right there. Oh, I do want to say that we did blast email most of this information out. We tried to last Friday to most of our regulated facilities that we have email addresses for. We try to push out the information to the chamber so they can push it out to their members. But we do have a big green button for these guidelines. It's on our main COVID page at the SNHD website.
Okay, thank you so much, Chris. You know, we're getting a lot of questions. Companies are asking us as they're putting together their plans, is the health district able to review reopen plans that companies would be putting together to get ready to open? And any one of you can answer that question, whoever wants to jump in.
I guess I'll start and then I'll let anybody else jump in if they need to clarify. We've been reviewing other government agencies, other regulatory agencies to kind of help them out. As when it comes to private business, of course, we can't review, thousands and thousands of documents. That's why we try to put out that general guidance. Of course, we're always here to answer questions and everything like that. And I'll leave it up to any of the others if they have other things to clarify.
Yeah, this is Larry Rogers with Food Operations. I just wanted to point of clarity. I keep hearing a lot of questions about a reopening inspection. That's not going to be necessary. We may find other jurisdictions doing that, but we don't have the resources to actually go and inspect every single restaurant prior to reopening. It usually takes us a year to get to every restaurant during the normal course of business, and right now we can't. However, I will reiterate what Mr. Saxton said. We do have resources on the website available. Of course, if you have a relationship with your inspector, you can reach out to them. Any general questions, any type of documents you want us to take a quick look at, we could probably do that. I mean, we're here for you as much as we can be, and we're trying to work through this together. But like Mr. Saxton said, we can't spend large amounts of time at each individual. We have 21,500 permits and I've got 60 inspectors, but we will do the best we can to guide you through this process.
That's great, thank you. So if all the restaurants are getting ready to, at the time that they're getting ready to open, they don't have to necessarily expect to set up an inspection and so forth.
Yeah, and that's correct. And that's consistent with our regulations. If a business self-closes, and that's what's happened in this situation. In our regulations, they're more than allowed to reopen without our intervention. Again, we do have the guidance documents in place to help them and give them some advice. It's good advice. It's been vetted. It's going through, our clinical services, our epidemiologists. Of course, we're the environmental specialists, so we put our stamp on it. I think it's good advice, and we're in a period of unprecedented cooperation with industry. I'd like to thank everyone for all your cooperation in keeping Nevadans and our guests safe. I think we can continue that. I think we've actually done a very good job looking at the national level and even international. I think Nevada's, Las Vegas in particular, has been an example for everyone to follow. I'd like to see that continue, and we'll help out any way that we can.
Okay, very good. Councilman Knudsen, let's go to you. I know there are some requirements that the city of Las Vegas is waiving or delaying so that companies can go ahead and go sooner.
Thank you very, very much, Mary Beth. So your first question was about how are businesses applying information to the health district. I also want to let everyone know I've had many business owners and representatives reach out to me with their plans for reopening. I think it's important to know that there are a variety of regulatory agencies in our valley, and so making sure each and every one of your members is connected to that regulatory body and asking questions and also providing ideas is a really important part of this process. We're all learning and growing at the same time, and everybody wants to open up in a safe and responsible manner and make Las Vegas as competitive as we possibly can on a national and worldwide scale. And so your second question is, what is the city of Las Vegas doing? We've done a variety of things from a regulatory standpoint that make it easier for businesses to do business during this zero phase, or this phase when we only allow for essential businesses. And I think you're going to see that continue. On tomorrow's council meeting, we're codifying until January the allowance for businesses to do curbside pickup and delivery of alcohol. We're also encouraging businesses in the downtown, the redevelopment area, to board up responsibly, but also to provide curbside delivery and pickup. And so for those businesses or business owners on the line that have ideas about how the city can continue to encourage business growth in this unprecedented time, I think we're open and willing to listen to every idea.
Okay, very good. Thank you very much, Councilman. To go back to Larry, in the meantime, we got a question for Larry to clarify regarding restaurants. If a restaurant was closed for a health violation, what happens to that restaurant? And I would assume they would stay closed?
That's correct. What can happen, and that can happen now even prior to reopening, because they could be open for delivery, dine out services. They would contact their inspector and schedule a reinspection. We of course can do even during this time, even if they're not open to the public, we can ensure that the violations have been taken care of. Close for an imminent health hazard, say a backed up sink or something like that, or no hot water, we can go out and verify that that's good, do the regular inspection, and then your permit will be in good standing. And then as soon as the governor lifts his orders, you could open up. I don't think we have, last I checked, we don't have anybody under that status, but we may have one or two that have missed my view. So, but that's correct. If they were closed by the health district, they would have to remain closed until they got their reinspection. But the reinspection can happen now, so there really shouldn't be any hold up to anybody reopening.
Okay, very good. We're getting a lot of questions about timelines as well. And I know the governor's talked a lot about phase 0, phase 1, phase 2, and 3, and so forth. Will you all be giving timelines of when certain types of companies can open and what those restrictions might be?
Well, I think just like us, we're just going with the governor says. We don't always get a lot of lead time on that. So what we're just looking at is his own timelines. Is those who watch his address, they know he's been talking about every 2 or 3 weeks, he would reevaluate and go with that. Really, in developing our phase 1, just take for restaurants, for example, phase 1 is, we looked about what would be good public health practices to help get our facilities ready now, so that we're not trying to give them guidance documents, the day before the reopening happens, and to try to help them out that way. And so we, of course, can't open industry ourselves. That's all the governor. So we can't give any extra guidance other than these are the best practices that we think you should follow once that opening comes from the governor.
Okay, great. We've got a couple of longer questions here, so I'm just going to kind of read them. In phase 1, is it still true that salons can reopen voluntarily, as stated by the governor's roadmap, as long as the new guidelines issued by the state cosmetology board are followed? Anybody know the answer to that one?
Those aren't businesses that we regulate. The Nevada Department of Health and Human Services, I believe, do the barbershops and salons. So I don't think it'd be appropriate for us to comment on that.
Okay.
Chris, do you have any thoughts?
Yeah, each of those, either is the Board of Cosmetology. I know the barbers have their own board, and so they should go there for more information. Since we don't regulate those, we don't look as closely to those facilities.
Okay, very good. I believe we have Councilwoman Olivia Diaz on now. Councilwoman, are you there? Maybe not.
Can you hear me?
Ah, yes, there we go.
Oh, hi, good afternoon, everyone. To the question about the cosmetologist, I think that's still being deliberated based on a call that I was on yesterday evening. They are asking the governor to consider them and allow them to reopen under phase 1, but I don't think it's official yet, Mary Beth.
Okay, very good, thank you. Here's another question. Is there a plan to be able to open restaurants for dine-in, but with restrictions anytime soon?
Again, this would go back to the governor's orders. We have anticipated that the governor will be doing that at some point in the future. I don't know what his timeline might be, but we do, and our guidance that we've currently released, we have a preparing for reopening, so kind of a phase 0. We've also put in guidance for what to do if you're doing delivery only. That's currently on the website, and then we've also released a what to do during phase one. We've had to leave some of the language a little bit vague, like, how many patrons you can have in, because we've gotten some different guidelines from different states looking around. But we do have some things that you can look at now to sort of prepare for when the governor does release that. As far as the timeline, I don't know. We haven't heard any word.
Okay, very good. This is a city/county question. Will the city or the county make disinfecting supplies available based on square footage and number of occupants to ensure that we don't run into supply constraints running our opening schedules?
This is Brian Knudsen, and I will ask Olivia Diaz to join in if she wants, but we're going over our budget now, and I think there's opportunity to continue those conversations. And so if anybody on the line would like to reach out to us with ideas or suggestions, I think it's definitely something that as a community we need to look at. Whatever those supplies are that are going to be hard to manage, whether they be face masks or gloves or disinfectant, if those are important for your business to open, it's important for us to know what they are so that we can make the appropriate decisions going forward.
And you stated everything very eloquently. I don't need to add anything, Councilman.
Okay, very good. Are health inspections mandatory for reopen?
For food establishments, and I'll let Herb jump in because it's different for the hotels, but for food establishments, no, they are not mandatory for reopening. They can reopen as soon as the governor gives the orders.
Okay.
To public accommodation facilities, large and small ones. There's several things that need to go on that the facility needs to perform. And one, looking at the Legionella side of the house with safe drinking water. Rob Cole will go ahead and explain some of the procedures that need to go out, but we send out guidelines on what a hotel needs to do in flushing their lines. In regards to just the mom and pop operations, as far as a general store or a facility that we don't regulate, we put guidelines out there that they should flush their faucets for 5 minutes. But I will turn over to Rob Cole to go ahead and explain what they're doing for Legionella. And then as far as opening the facility itself, each one needs to go ahead and open up on their own time frame. As long as they meet the checklist that we provided them, the guidelines, they can go ahead and proceed. If they need any questions answered, we'll gladly go ahead and communicate that. If there's some confusions with the guideline, we're available to assist. And if there's a necessity for us to go out on site, we will go ahead and help them. But remember, we're limited in resources as well.
Thanks, sir. Hi, everybody. This is Rob, and I coordinate the Legionnaire's Disease program here at the Health District. And what we're doing right now is an outreach program just for hotels and motels to try and guide them through the flushing of their water pipes so that their water doesn't stagnate and grow the bacteria that causes Legionnaire's disease. And for those that don't know, it's bacterial pneumonia. So the overall goal of my project is to prevent future cases of bacterial pneumonia once these facilities open up. What we've created is an online survey that each public accommodation can fill out. And when it comes back to us, our team member can contact the facility and help them individually develop their own flushing protocol if they don't already have that. And we're recommending that each facility flush their water lines at each fixture for a minimum of 2 minutes for hot, 2 minutes of cold throughout the facility if those rooms are unoccupied. But the first step for the Legionnaire's Disease program is to either contact myself or the health district and get a hold of this survey and fill it out, and our team will contact you and even do a site visit if necessary to teach these facilities how to properly flush their water lines.
And then I'd just like to add that for childcare facilities, body art facilities, and aquatics, public swimming pools and spas, We're not going to be doing, similar to Larry's program, we're not going to be out going and doing inspections to reopen them, but the checklists to reopen are on the website. So please take a look at those before you open them.
Okay, very good. Thank you. We're getting a lot of food related questions. So Larry, gear up here. Are there any specific requirements for catering companies, and is a buffet line an alternative? I think we've had some conversations about buffet lines.
It's all going to depend on what the governor wants to do and what he releases. It's important for restaurant owners to know that the normal regulations stand, that our normal regulatory activities haven't ceased. However, we haven't been, the Board of Health or the governor's office hasn't empowered us to enforce any of the governor's mandates. That's been left to the police department and business licensing entities. However, I will say that there's been some talk about it. We haven't needed to do that. Everyone has been very cooperative and very vigilant about keeping Nevada safe. So again, thank you for that. As far as a buffet line being used during catering, I'm not sure that that is going to be advised. This is speaking from a recommendation side. If catering is allowed to resume, it would probably be our suggestion during phase 1 and probably phase 2 that the dishes be served by one of the caterers. Having self-service right now is a potential way to spread COVID-19. And I'm pretty sure our recommendation would be to avoid that at this time.
Yeah, I will go Larry's suggestion. Also in the phase 1 guidelines, we do say we know some facilities have buffets, whether they're the brick and mortar or the, as you said, the caterers. And so we're recommending not to allow customers to go through there, but we're trying to see how they could still use them. So if you have your own food handler, you can get orders, go to the buffet, get the food, bring it to the customer, or other processes. Those are a way of
Okay, I'm getting this question a lot as well. The governor stated that bars will remain closed. A lot of questions from people asking how to distinguish between a bar and a restaurant or a bar restaurant.
Well, permit-wise, I mean, we have a drinking established permit, and that would be your bar. And then if you have a permit for as a restaurant, I would assume that would be a restaurant. So take a place, you know, some of these gaming facilities that do serve food. I don't want to name names because I don't want to leave someone's name out. But if your business model is to serve food, then I would say you would fall under the governor's definition of a food establishment, because you certainly fall under ours. If you're a drinking establishment, then that would the closure would apply to you. Does that answer the question?
Yeah, and just to add to that, we'll have to see what the governor says. We do know we have facilities that have a restaurant and then a bar attached. That bar might have to be closed, but if your restaurant's allowed to open, you got your table spaced 6 feet apart. You could order alcohol and have it delivered to the table. You just wouldn't be able to sit at the bar. Currently, that's what we have in our guidelines looking at that.
And I'll just say, from a common sense standpoint, I think the governor is really trying to limit activity at nightclubs where you have a lot of people congregated closely together. And I'm speaking for the governor in a sense, but just looking at his intent, I think that's what he's talking about. I don't think he's talking about a sit-down restaurant where, when he does open dining in with, you know, that would, you know, bring you a drink with dinner. I'm pretty sure that's not what he's referring to.
Okay.
But check with the governor.
Yeah, we'll do that. But the questions are pouring in, so I'm going to try to get through these. How do we submit a plan review for a brand new food truck? Is that Karla?
Yeah, that's me.
No,
Same way you
always.
always. Sorry?
Food truck is me.
Okay, go for it.
So I don't think we've slowed down some of our plan review process for trucks. And yes, Karla is our plan review manager. However, a niche program like mobile vending, I've taken that. So we have not slowed down our mobile vending. We have slowed down, but we still are taking applications. If you submit that to Tanya Baldwin or Jake Billings, we'll process it as normally. I think we've gotten this question several times, and we are continuing to do plan reviews for mobile vendors.
And I'll just add, if you're trying to permit a trailer or something like that, that is still handled through the plan review office. And we are accepting applications online. So just go to our website, go to the plan review page, and you can do all that online.
Okay, great. This question is from a child care organization. If we are a child care that closed but receive our PPP loan, is it okay to bring back the staff to start cleaning even though we're still under stay-at-home orders?
I would say that's fine to do as long as you're able to maintain those social distancing guidelines and your employees are wearing masks and, you know, you're able to wash hands and all that kind of stuff. But yeah, I would encourage that.
Okay, great. Is there any suggestion of how many people per square foot should be in a business?
Ran into this. I didn't think we got the square footage. I've seen a large variety of recommendations from various agencies. Right now, I don't think we're willing to commit to any kind of guidelines. We're waiting for what the governor says. Chris, did you want to address that maybe?
Yeah, looking at that, we just basically go with, can you have that 6 foot distance? We know there's a lot of different types of businesses out there. We didn't want to go with capacity, you know, where you could have 30%. We'll wait if the governor wants to weigh on that one. And again, with the square footage one, we're just going as long as you can social distance, that's really what we're pushing.
Okay, very good. Getting a lot of questions about swimming pools and about swimming pools at apartment communities and HOAs. Any guidance on that?
So right now we're interpreting the governor's guidance to mean that public pools should remain closed at this point in time. We still want the pools to be maintained. So we have been telling the pool operators to go out and make sure that they're checking chemicals, cleaning the pools regularly, doing all that normal stuff so that the pools stay clean and in good condition. But at this point, the way we are interpreting the guidance is that the pools are to remain closed until we hear further from the governor.
Okay, some clarification on curbside. Are non-essential businesses that do not offer a curbside service able to open and return employees to work?
I'm just talking about food establishments.
Yes.
My understanding is if they're not offering curbside / takeout, the only other option would be dine-in. Am I missing something?
Delivery.
Yeah, if they're doing delivery or takeout, yeah, they can remain open or they can reopen if they're not open. But any type of dine-in options is currently prohibited.
Okay. Will there be any adjustment for fees for locations that are not currently open but have permits coming due?
I don't think we've discussed any plans to waive any permit fees.
Yeah, technically the permit fees are good for that fiscal year, which is July 1st through June 30th. So I know we have some in plan review coming through change of owner or whatever that, you know, they applied in March for that change of ownership. If they went into operation, say they applied in January, they went into operation. If they operated at any point during this fiscal year up until June 30th of 2020, they have to pay for that permit. So hopefully they've already paid for that because billing went out in July, but to my knowledge, we're not going to be doing any waiving or changing the fiscal year to accommodate the delays. Chris, do you have any other thoughts on that at this time?
Yeah, that hasn't been discussed at this point, so I'll just leave it at there.
Okay. Next question is, how long should employee absence or illness logs be kept on file And do they need to be reported to the Southern Nevada Health District?
So if we're talking about food establishments, I would just say that facilities should follow your normal employee illness policy. The illness logs and things like that aren't mandated, and we haven't implemented that. That's probably a good idea to have, but that we don't need to review that. You don't need to submit that. That's for your own internal employee / client illness policy.
Definitely, if you have a suspected case with one of your employees, we encourage either them or the employee to reach out to the health district to let us know so we can follow up and do any kind of tracing.
Okay, and I think there is a log template available on the health district website, if I'm not mistaken.
That's correct.
Okay.
So yeah, that is mostly just to assist the businesses, help them with their checklists, and of course we link to the CDC with any kind of guidance. When can the employees come back to work? What needs to happen? What kind of symptoms, to kind of make it as easy as we can.
Okay. Next question is, will there be a system in place where Las Vegas will clean the streets, bus stops, and other public areas with disinfectant cleaner?
I think I'll leave that to the council person, perhaps.
This is Brian Knudsen, and Olivia Diaz can chime in. We do that for the most part in downtown, and the RTC, I believe, does it for all the bus stops throughout the valley. I see that on a regular basis now. I imagine, given the situation, that those efforts will be increased.
I agree, Councilman Knudsen. I have seen the RTC. I think they contract with a certain vendor, and I do see them doing cleanings of the bus stops in my ward. And if there is any area that you want to bring to our attention and you feel is being not properly maintained, please feel free to contact Councilman Knudsen and I and tell us where in the city boundaries this is. If it's not within the city, then maybe we can relay the message to whatever jurisdiction oversees that. But I think right now, keeping our city clean is a priority. So please keep us informed if you're seeing something.
Oh, and if I could just go back to that previous question with one other comment. When we're talking about employee illness, there's certain health information you need to keep confidential. There's things you can share with the health district. Make sure you're not putting up logs on the wall for all other employees to see. I'm sure most facilities know that, but just wanted to put that out there again.
Okay, thanks, Chris. Will the health district be requiring employee temperature checks?
For food establishments, we have no plans on making that a recommendation. We do encourage people to follow their employee health policies and do some enhanced questioning for COVID-19 specific symptoms. However, we're not, at this time, there's no talk of us requiring the temperature checks. The problem with that being is that your typical restaurant owner or manager isn't medically trained. So I think I would be hesitant to recommend that. Just liability issues. I mean, if you miss something because you weren't taking the temperature properly, that could open up some problems for you. So I would be careful with that.
Okay. On that note, are there specific types of thermometers that businesses should buy or that people should buy?
I'm not going to recommend a thermometer for that purpose. Chris, did you want to weigh in on that?
Yeah, there's medical grade thermometers built just for that purpose. We can't recommend any certain vendor. We can't really require any of these. It's the governor that would require businesses to do that. We can only recommend. We would at least recommend that they use our sheet. You're looking at employee illnesses. And from there, if you want to do temperature checks, we're leaving them to the business until such a time that the governor requires.
Okay. Next question is, are there significant guidance points for higher educational institutions or other training educational facilities? Higher education.
I'm sorry, could you repeat the question?
I could hear that.
Yeah, sorry about that. There was some feedback on the line. Are there significant guidance points for higher educational institutions or other training educational facilities?
I think we're going to leave that to the Nevada Board of Education. I believe they're working on a guidance document at this point.
Okay, great. Next question. Where do showrooms fall, such as furniture stores?
So furniture stores can use the same guidance we use for general businesses. And yeah, we'll see, of course, what the governor says going forward after the May 15th date.
Okay, I'm getting this question a lot too regarding businesses' ability or is the onus on them to require customers to wear masks?
Well, there's nothing in our health guidelines requiring masks at the time. We can only recommend, just as the governor does, the public wears masks and the employees of any facilities. He hasn't, and so that's pretty much our thought process there is the recommendation. It should be done, but the governor is the one to mandate such actions. Of course, there's nothing stopping a company for mandating it themselves, which I believe Costco and some others have.
Upon reopening, I'm getting this one a lot too. Upon reopening, should employees be required to sign an acknowledgement of a policy on preventing the spread of coronavirus, and what are best practices?
Should they? Yeah, I don't think that's a bad idea. I think it does demonstrate to your employees that you're dedicated to following the guidelines, and it also, gives you something to say, hey, you were informed not to show up to work with these. Are we going to mandate that? I don't think that's in our plans.
Okay, do you have any guidance or suggestions on offices with cubicles, spacing and so forth?
This is Mark Bergtholdt here. I would suggest that you refer to our website. There's guidance there on how to open a general business, maintain the 6 feet, and disinfect high-touch surfaces.
Thank you, Mark. I appreciate that, that you chimed in there. One person did just ask, they apparently are on your website right now. Can you give just a little bit of direction on where on your website they can find these checklists and questionnaires? They're not.
Yes, I have a very easy way to find it. It's www.snhd.info/reopen. If you want me to say that again, I'll say it again. www.snhd.info/reopen, and that'll get you right to the website.
Great, thank you very much. To whom can we direct a question regarding classroom and outdoor safety training for motorcycle riding?
This is Brian Knudsen. That's a tough one, but I'm going to jump in and take it. So if you want to reach out to me, I'm all on board. I'll find out. So my phone number is 702-493-1547, and I'll try to have an answer for whomever's asking that question.
Okay, great. Has there been any discussion of implementing cleaner indoor air methods such as UVGI?
In restaurants, we're going to go with the guidelines that the CDC has recommended, and those will be recommendations from us. I don't recall seeing anything along those lines. Certainly anything that a restaurant can do above and beyond would be fine as long as they're not hurting any of their customers, but I haven't seen that recommendation. I think the disinfectant, anything on the list and for your high touch services is the current recommendation.
Okay.
Just to add on to that, if your facility, its ventilation system, if you can get more fresh air going through your facility, I believe that's also part of our guidelines.
And on that note, that'll be part of our webinar that we're having tomorrow at 11 o'clock as well. So for answers to those types of questions. Wait, sorry for the feedback, everybody. Is everybody muted? It's not me. Sorry, guys. Next question. Regarding having someone who tested positive at our workplace, not a restaurant, is there any updated guidance as far as how long before employees can come back to work? And should other employees work closely with a positive person also be sent home to quarantine?
You want me to handle that?
I'll take a stab at this one. So the current CDC guidance for isolation, self-isolation, if you test positive, is that you stay home for a minimum of 10 days post-illness onset and 3 days once your symptoms start resolving. So that's the current guidance for self-isolation. And then if you have an employee who tested positive, all positive results have to be reported to our Office of Epidemiology and Disease Surveillance. And that person would then be contacted by one of our disease investigators. They would identify any contacts that person had, and then the contacts would be contacted by our disease investigators to instruct them on whether they needed to isolate or not.
And just to add to that, I know this can be kind of confusing. And so for our COVID questionnaire, we link right to the CDC website. It goes through what you need to do, when that person can return to work, how many days they have to be out. So you don't have to remember 2 weeks from now what it is. Right there is a link right in our document. You just click, you go straight to the site and it tells you.
And this is Mark here.
We lost you, Mark.
Oh, sorry. I hit the wrong button. My apologies. There is a link on our website to key in info for your name and email address. And if that information gets updated, you will be notified of those updates. So it's important to keep updated. And if those do change, we will update that employee questionnaire so that you get the current information on that.
Yeah, it's important to note that the CDC has updated that isolation guidance, I think, 3 times since we started this process in February. So things do change.
Oh, great. And on that note, does the health district have any training videos at all that we should be aware of? Or that we could share with our employees?
I don't believe we have any COVID related videos. We just have our general videos related to like restaurants, other facilities where we go through safe food handling practices. But at this time, I don't believe we have any COVID videos. Karla?
One group was working on a training video for shelter operators, but I think that got put on hold.
Okay.
For hotel
That's
operators,
something the community wants. Maybe we can explore options of adding those type of videos. We'll investigate that.
Yeah, that's a great idea.
for hotel motel operators, if they're interested in reducing water stagnation for Legionnaire's disease, we recommend the CDC training. And it's called Prevent LV.
Okay. Great. Several people are asking where to go now for testing.
So there is a community testing site that's open to anyone. It just opened this morning at 8 o'clock at the Orleans parking garage. I believe they're going to be running that thing 7 days a week. I'm not sure what the hours are on it, but you know, I would assume during normal business hours you could get in there. And if you feel like you have symptoms and you want to get tested, you should contact your private physician and they can direct you on how to get tested as well.
Okay. Do restaurant workers have to wear gloves now, or is it just recommended, especially for those preparing food?
So our regulations haven't changed. Restaurant workers are prohibited from handling food with bare hands, ready to eat food with bare hands. That's the extent of our regulations. Specific COVID-19 use, while that's a good recommendation, especially if they're handling credit cards and things like that from the public, that is not a requirement by the Southern Nevada Health District.
Okay. What will a guidance and checklist for food establishments during phase 2 look like? So
we're currently taking a look at that, but what that's going to look like, I'm not ready to comment about that until we've finalized, and I have a team working on it right now. And again, we're still don't know what the governor is going to say about phase one, so we might be a bit premature. Anything I say right now could change drastically here in a couple of weeks. So I focus on phase one would be the take-home message.
I think everybody's eager to get through the phases, so they're trying to ask as many questions as they can about that. I think social distancing is probably going to be the answer to a lot of the questions. Using common sense with social distancing would be the answer to a lot of the questions I'm getting. This question is, what about employee lunchrooms? What will that look like in terms of people socializing and keeping their distance? Guidance on that?
Yeah, the same guidance. I think you hit the nail on the head. It's a lot of common sense approaches. I think the public is starting to kind of get what's going to be expected and what the new normal is. And your social distancing, the 6 feet apart, is probably going to be the new normal. When I take lunch, when I come into the office, we do make sure that we maintain ourselves 6 feet apart, and that's probably what America is going to look like for the next foreseeable future.
And a few things to add on top of that is also washing your hands 20 seconds before and after lunch, and also disinfecting where you ate your lunch so that the next person who sits down there does not pick up any coronavirus that might be spread.
Okay, great point. Is there any guidance for dentistry, or should we continue with teledentistry and only triage emergency cases? Anyone want to take that one?
That would be a question that you would need to ask to the Board of Dentistry.
Yeah, that one's a little bit out of our wheelhouse.
Okay, great. Let's see here. Do I need to ensure that employees are at least 6 feet apart while at work? And I think the answer to that is yes. We have an open office format with low cubicle walls. What should I do to protect my team at work? It's kind of another cubicle question.
So I think just going back to the food establishment, when the governor did, and I've gotten this question several times from industry through emails, the governor did specifically say maintain the 6 foot distance as much as possible. I recognize if you're walking next to people in hallways that you may pass within 6 feet of people. I think the governor's expectation is that you try the best that you can and don't willfully violate the social distancing. So I'd say as long as you are trying to do that, and then with the low-rise cubicles, maybe look at some plexiglass shields. We've seen them all over the place. That's becoming commonplace. That's another thing that we would probably be comfortable recommending.
Yeah, another thing we're doing in our office here is we have a similar thing where we have 3 people in a room with cubicles, and where you can have people continue to work remotely. Like maybe you can have part of your staff working remotely and then part of your staff in the office so that they're able to spread out amongst cubicles, or working different shifts, or things like that, just to spread them out physically.
Yeah, it's that social distancing is going to be the key to everything, I think. Here's a question. Can employers test for a fever?
Chris?
Well, there's nothing preventing them if they wanted to get one of those Hilltown thermometers. We can do a touchless, basically read on a person. Now, whether they can diagnose, no, it's only like a guiding tool that say, okay, maybe you have a fever now. What other symptoms do you have to go with this that might show that this is COVID? And then they can go down again. We'll keep going to our guidance documents. We have our questionnaire, and it tells you, okay, this person has these symptoms now. According to this guidance, I need to send them home. They can't go to work. They need to check with their medical professional, and then go from there.
Okay, do we know who will be conducting or who will be responsible for contact tracing of the general public?
Yeah, so that's falls into the purview of our Office of Epidemiology and Disease Surveillance. So we currently have staff that are doing that. They are also looking at bringing on an additional 54 contact tracers. So right now we're working on plans to train up those people. They're looking at National Guardsmen and then our Medical Reserve Corps to conduct those activities. But first thing is we need to find space for them and we have to get them trained up.
Okay, next question is, will furniture showrooms and dispensary showrooms be included in the reopening of businesses as long as they follow the rules from the health district?
I'm sorry, did you say dispensaries?
Yes. Furniture
Dispensaries fall under the Department of Taxation. We don't regulate those at all, so I can't speak to that.
So yeah, a lot of it will just be going to what the governor does end up coming back with on May 15th. All we really would say is if it's a business we don't regulate, we hope they would follow our guidelines. I'm sure there might be some more put out by the governor as we get closer to the 15th.
Okay, next question. What should we do if a positive test is from a janitor that was cleaning the building in which several businesses were located?
So have our janitor reach out to our Office of Communicable Disease Investigators. Karla, any idea?
Generally, if you can, if you know you've had a positive, it's a good idea to deep clean the place if you have that opportunity. But generally, if there's an issue, like I said, our disease investigators will contact any cases and notify them of, any potential exposures and give them further instructions on what to do.
And that is correct. Oh,
yeah.
That is correct. What we do as far as OEDS does is they will also refer it back to EH, and we'll get in contact with the business and advise them of where the employee was and what they need to do to ensure that the COVID-19 virus is removed from the facility.
All right, thanks, Mark.
Okay, next question. Are there guidelines for the safe disposal of disinfecting supplies like wipes, papers, and things like that that are drenched in strong chemicals that are intended to kill corona? So disposal of cleaning supplies.
As far as the disposal of the cleaning supplies, we'll handle it as normal household waste, and they can go ahead and put it in their normal receptacles for waste. And Republic or whoever services your area for waste collection will go ahead and take that. It's not considered medical waste at all.
What about guidance on handling cash? We all touch cash now and then.
I mean, common sense, I would think that employees wearing gloves, although it's not recommended to protect employees and to prevent, to stop the cycle of infection, frequent hand washing, of course. And then, if they're at a cash register constantly handling gloves, they should be wearing gloves, or handling cash, they should be wearing gloves. I've seen that all over town. I think that's a solid recommendation and one that I've seen just about most people doing.
Okay, this question is about social distancing in kitchens. Most restaurants can't just remodel their kitchens. How do we social distance in these close quarters?
I think I touched on this earlier I did take a look at the governor's executive orders. I think someone wanted me to put a statement out that it was okay to be within 3. I'm not going to do that. I'm not going to contradict anything the governor says. However, in the governor's orders, it was as much as possible. I think we understand that incidentally you will be, walk next to people and that sort of thing. So as far as the social distancing, that's something that everyone should strive to do. There should be no willful disobedience of the governor's orders, but I think incidentally it'll be fine. If you just can't stay, if you have people within 6 feet of each other as a normal routine, I think it might be time to reevaluate your business practices, at least for the short term.
Okay, we have time for one last question. What kind of deep cleaning meets the guidelines for decontamination in this type of situation?
Mark here, I'll answer that one. A deep cleaning would be one where you follow the CDC guidelines. There's actually a link on our website to that information. But basically it is you wash it off with soap and water, and then you use a disinfectant on the surface that's on EPA list in, and you follow the directions that's on the label. Those products that are on EPA list in are registered by the Environmental Protection Agency as being effective by the manufacturer, effective in removing coronavirus. So that's probably the key thing to have on there. And make sure that you follow the contact time. And a lot of the investigations we've done, the contact time is not being followed, or they're using a product that has like a 10-minute contact time. In our arid environment here, those 10 minutes go by very, very slowly. So I strongly encourage folks to really focus on contact time and select products that have contact time that they can work with.
Okay, excellent. Well, we are out of time. I want to thank Councilman Brian Knudsen, City of Las Vegas, and Councilwoman Olivia Diaz, and of course, all of our guests today from the Southern Nevada Health District. Thank you all so much for your time. We really appreciate it. Does anybody have any closing remarks you'd like to make?
Mary Beth, this is Councilwoman Diaz. I just wanted to also add to what Councilman Knudsen said we're doing and adding more flexibility, because we know that we will have to be flexible and we will have to do business in a new way, bouncing back and getting strong, gaining our strength after the closure. So know that our folks in the business licensing department are looking and working hard to see how we can be a little bit more flexible in how our ordinances read. And also, if your business license expired April 1st or May 1st, know that you have 60 days to renew that business license. I know that a lot of businesses haven't been working, haven't been receiving much income coming in. So know that there will not be late payment or any kind of fees. We'll just allow you to renew within the 60-day window.
Oh, that's great.
Brian Knudsen, I want to thank you and the Vegas Chamber for hosting this, and those representatives from the Health District for providing information. I also want to add to those still on the call. I know this is a very confusing time. Everyone's trying their very best to figure out how best to get the Vegas economy open up. From a business perspective, I encourage all of the business owners to think about what your customers will expect of you as they walk into your business. And that's the perspective I think that is healthy, is your customers are going to choose where they go to business, and following the guidelines and maybe going above and beyond what's recommended by the governor or the health district is probably a safe place to be in. So putting your customers first and wondering what they're going to expect as we come out of this will make you more competitive.
Thank you, Councilman Knudsen. That's great advice, and we're going to leave it on that happy note. Thank you again to everybody from the Southern Nevada Health District, our city councilors, and everybody on today's call. We appreciate it, and be sure to tune in tomorrow for our webinar at 11 a.m. Thanks so much. Have a great day, everybody.
Thank you.
Thank you.
Bye. Good job, gents.